Welcome to another video in our series addressing questions on the health and safety of 5G. As we have discussed previously, 5G is not fundamentally different from earlier mobile technologies in terms of its use of radio frequency electromagnetic fields. 5G operates with both existing as well as higher frequencies, but that doesn't mean that we don't know anything about those frequencies and the safety of RF energy. So in today's video, we will look at the growing body of expert advice on the safety of RF in general and 5G specifically, the limits that apply, and the compliance of 5G sites with those limits. Let's start with the World Health Organization and their assessment of the amount of research that has been undertaken and the conclusions from that research. A large number of studies have been performed over the last 2 decades to assess whether mobile phones pose a potential health risk. To date, no adverse health effects have been established as being caused by mobile phone use. National health bodies in many countries have arrived at similar conclusions. For instance, the Public Health Agency of Sweden, who point out that, based on today's knowledge of radio frequency electromagnetic fields, researchers do not see that 5G and the specific frequencies used would pose a health risk. And the Norwegian Radiation and Nuclear Safety Authority, who also said that the overall research shows that the radiation from wireless technology is not hazardous to health, as long as the levels are below the recommended limit values. This is the prevailing view among researchers in many countries today. With the knowledge we have today, there is no need to worry that 5G is hazardous to health. Another example is Ireland's Environmental Protection Agency, which states that the effects of electromagnetic fields on humans have been subject to significant research. This includes the radio frequencies used and envisaged for 5G in mobile communications and other applications. No health effects have been proven at levels below the ICNIRP guidelines for members of the public. As such, no consequences for public health are expected from the use of 5G. Many expert reports and national advice reference the recommended limits or standards that exist. In this area, most countries have adopted the recommendations of the International Commission on Non-Ionizing Radiation Protection, also known as ICNIRP. ICNIRP is formally recognised by the World Health Organization. Like most countries, New Zealand's national standards are based on ICNIRP recommendations, and their Ministry of Health has said the existing New Zealand exposure standards covers all of these frequencies, and research published since the standard was adopted still supports the limits set in the standard. Germany's limits are also based on ICNIRP, and their Federal Environment Ministry has advised, according to current scientific knowledge, regardless of the technology used, the electromagnetic fields do not present any health risks if the limit values are observed. And finally, Public Health England has said of their ICNIRP-based limits, the overall exposure expected to remain low relative to guidelines, and as such, there should be no consequences for public health. In terms of compliance with these limits, many national agencies have also been carrying out monitoring of base station emissions. Again, the Ministry of Health in New Zealand has said, measurements at test sites suggest that exposures from 5G transmitters will be similar to those from the current technologies. And the UK's telecom regulator Ofcom, which has been undertaking a measurement program of base stations in the UK, including those providing 5G mobile services, has found in all cases the measured EMF levels from 5G enabled mobile phone base stations are at small fractions of the levels identified in the ICNIRP guidelines, the highest level recorded being approximately 1.5% of the relevant limit. So what can we learn from these reports and advice? The effects of electromagnetic fields on humans have been subject to significant research. No adverse health effects have been established as being caused by wireless technology operating below the recommended limit values. The limit values in many countries are based on the recommendations of ICNIRP. And exposure compliance measurements from government bodies and agencies consistently show that RF emissions, including from 5G, are only a small fraction of the relevant limits. Well, we hope that the advice from these expert bodies has helped to answer some of your questions on the safety of both RF in general and 5G. Thank you for watching, and if you like this video, please share it and don't forget to subscribe so that you can receive notifications for each new episode.